Are you preparing for the NCLEX-RN and feeling overwhelmed by all the information? Don't worry, you're not alone. In this session, we're breaking down the most important NCLEX strategies that will help you tackle even the trickiest questions with confidence. But we're not stopping there. We'll apply these strategies to real NCLEX-style questions, analyzing not only the correct answers, but also why the other options are right or wrong. This approach will sharpen your critical thinking skills and help you avoid common mistakes on exam day. Boost your confidence, master key strategies, and tackle practice questions like a pro. Let's dive in. One of the most tested areas on the NCLEX-RN is prioritization and delegation. This is a big one, and it will really challenge you to determine 1. Which patient needs immediate attention, prioritization, and number 2, which tasks can be delegated safely, delegation. Now let's set the scene. A nurse is assigned to care for 4 patients on a medical surgical floor. The nurse must determine which tasks can be safely delegated to an unlicensed assistive personnel, UAP. Which 2 tasks should the nurse delegate? Here are your options. A. Assisting a patient with ambulation who is recovering from a total knee replacement. B. Monitoring vital signs for a stable postoperative patient. C. Performing a dressing change on a patient with a stage 3 pressure ulcer. D. Educating a patient with newly diagnosed heart failure on fluid restriction. E. Evaluating a patient's pain level after administering IV pain medication. F. Assessing a patient who reports sudden onset of chest pain. Take your time to think about these options. It's important to reflect on each one. All right, now let's reveal the answers. The correct answers are A. Assisting a patient with ambulation who is recovering from a total knee replacement. B. Monitoring vital signs for a stable postoperative patient. Let's break this down, step by step. Why are these the correct answers? A. Assisting a patient with ambulation who is recovering from a total knee replacement. UAPs can assist with activities of daily living, ADLs, like ambulation. In this case, the patient is stable, and early ambulation is crucial for recovery after a knee replacement. The nurse should make sure the UAP is aware of any weight-bearing restrictions before delegating this task. B. Monitoring vital signs for a stable postoperative patient. UAPs are trained to take vital signs and report them accurately, but they cannot interpret them. The nurse remains responsible for evaluating the patient's response to surgery and taking action if needed. Why are the other options incorrect? C. Performing a dressing change on a patient with a stage 3 pressure ulcer. Wound care involves assessment and sterile technique, which fall under the RN or LPN scope of practice. Delegating this to a UAP could put the patient at risk for infection and lead to improper wound care. Educating a patient with newly diagnosed heart failure on fluid restriction. Patient education requires critical thinking as it involves assessing the patient's understanding and ensuring they know how to manage their condition. Teaching is an RN responsibility as it requires medical knowledge and an individualized care plan. Evaluating a patient's pain level after administering IV pain medication. Pain assessment is an RN role because it involves evaluating the effectiveness of the medication, considering potential side effects, and determining whether further intervention is needed. It requires clinical judgment, which the UAP is not responsible for. F. Assessing a patient who reports sudden onset of chest pain. Assessment of acute symptoms, especially sudden chest pain, is an RN's responsibility. Why? Chest pain could indicate a life-threatening condition, like a myocardial infarction, and requires immediate nursing assessment and intervention. Always consider the scope of practice. UAPs can assist with basic care, like ambulation and vital signs, but not tasks like medication, assessments, or education. Think about patient safety. Unstable patients need direct RN attention. Prioritize tasks based on urgency. Use frameworks like ABCs, Maslow's hierarchy, and always apply critical thinking when deciding. You're doing amazing. Keep practicing, and these questions will start feeling more natural. Let's see another practice question now. Take a deep breath and focus, because this one is an important one for your NCLEX-RN prep. A patient with chronic obstructive pulmonary disease, COPD, is admitted with worsening dyspnea. What is the nurse's first action? Here are your options. Option A, administer prescribed oxygen therapy. Option B, obtain a detailed history of the patient's smoking habits. Option C, educate the patient about lifestyle modifications. Option D, perform a comprehensive physical assessment. Take your time, think it through, and choose the best action.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.
Okay, ready? The correct answer is Option A, administer prescribed oxygen therapy. Let's break down why this is the correct answer with a strategy application. Why is this the correct answer? The patient is experiencing worsening dyspnea, which is a critical respiratory issue. In this case, the first priority is oxygen therapy. This is an immediate intervention needed to ensure the patient is receiving enough oxygen to stabilize their condition. Why does this come first? Because dyspnea can quickly lead to respiratory failure, and oxygen therapy is a life-saving intervention. Now, according to Maslow's hierarchy and the ABCs, airway, breathing, circulation, oxygenation must always come first. The nurse needs to address physiological needs first before doing anything else, even before performing a physical assessment or providing education. Why are the other options incorrect? Option B, obtain a detailed history of the patient's smoking habits. This is an important task, but it's part of assessment, which is typically the first step in the evaluation process. However, in an emergency situation like this one, intervention, oxygen therapy, must come before gathering a detailed history. Data collection is secondary when the patient's breathing is compromised and immediate action is needed. Option C, educate the patient about lifestyle modifications. While education is a key part of the nursing process, it's not the priority here. The patient is struggling to breathe. Education should come after stabilization. You cannot effectively educate a patient who is gasping for air. So, stabilization comes first. Then you can provide lifestyle modification education once the patient's condition improves. Option D, perform a comprehensive physical assessment. Although assessment is the first step in the ADPIE process, in this case, the patient is in acute respiratory distress. The priority is to stabilize the patient's oxygenation first. Once the patient is stabilized with oxygen therapy, then a comprehensive assessment can follow. You need to ensure oxygenation is adequate before diving into further assessments. Final takeaways for applying ADPIE and NCLEX-RN questions. Always follow the added process systematically, but recognize when urgent intervention overrides assessment. Use the ABCs, airway, breathing, circulation, to prioritize physiological needs before planning or education. Assessment is key, but if the question involves a life-threatening issue, intervention must take precedence. Consider Maslow's hierarchy. Physiological needs like oxygen, circulation, and breathing always come before psychosocial aspects like education or history taking. Great work! You're mastering the NCLEX strategies. Keep going, keep practicing, and these questions will feel like second nature. You're doing awesome! Now let's take a closer look at the second strategy. Understanding the nursing process, ADP. Let's break down each step of ADP. Assessment. This is all about gathering objective and subjective patient data before making any decisions. You collect information through interviews, physical exams, lab results, and any other data sources, and think, this is the foundation. Diagnosis. This step involves identifying nursing problems based on the assessment findings. You're recognizing the patient's needs and pinpointing what needs to be addressed to improve their health. Planning. Now we develop measurable goals and interventions tailored to the patient's unique needs. It's about setting clear, achievable objectives and deciding on the most effective care plan. This is where critical thinking comes into play. Planning is everything. Implementation. This is where the rubber meets the road. You take nursing actions to address the identified problems and execute the care plan you've developed. Now you're actively caring for your patient. Evaluation. After implementation, you assess the effectiveness of the interventions. Is the patient improving? If not, you adjust and make necessary changes to the care plan to get better results. This is an ongoing process, always reevaluating. Now that we understand the nursing process, let's move on to two important strategies to help solve NCLEX questions. Important strategies to solve questions. 1. Determine if the question is asking for assessment or intervention. This is key. Many times, multiple answers may seem correct, but you need to know if the question is asking for data collection assessment or action intervention. If you get stuck, remember this. Intervention often takes priority over assessment in situations where immediate action is needed. 2. In emergencies or physiological crises, intervention takes priority over routine assessment. Think about it. If a patient is experiencing oxygenation issues, severe bleeding, or even cardiac arrest, your first priority is to intervene immediately. This could mean things like administering oxygen or performing CPR. Assessment will follow, but action comes first when it's an emergency. Now, take a moment to reflect on these strategies. By focusing on EPI, you'll be prepared to make systematic, well-informed decisions that prioritize patient care. Maslow's hierarchy of needs. Let's dive into this foundational concept, which will be a game changer for your nursing practice and for the NCLEX-RN. Prioritize physiological needs, e.g. airway, breathing, circulation, over higher-level needs like self-esteem or self-actualization. When caring for patients, nurses must always prioritize the most urgent and essential needs first. One of the most effective frameworks for doing this is Maslow's hierarchy of needs. This psychological model helps us determine which needs should be addressed before others, ensuring that patients receive care in the right order of priority. Now, let's see how this hierarchy works in action. At the base of Maslow's pyramid, we have physiological needs. These are the absolute essentials for survival, including airway, breathing, circulation, pain management, hydration, and nutrition. Pause for a moment. If these needs are not met, nothing else matters. Remember, only after these are taken care of can we move up the pyramid to focus on safety, love, and belonging self-esteem, and ultimately self-actualization. Now, let's apply this concept to a real NCLEX-style question. Are you ready? Here we go. A nurse is caring for a client who has just undergone abdominal surgery. Which intervention should the nurse prioritize? Here are your options. Option A, encouraging the client to express feelings about the surgery. Option B, ensuring the client's pain is adequately managed. Option C, assisting the client with ambulation to prevent complications. Option D, providing information about dietary restrictions. Take your time, think through the options carefully. The correct answer is Option B, ensuring the client's pain is adequately managed. Let's break this down using Maslow's hierarchy. Why is pain management the top priority? Pain relief falls under physiological needs, just like breathing, hydration, or circulation. Think about it. Pain management is essential for the patient's well-being and recovery. Uncontrolled pain can lead to complications, such as increased heart rate, high blood pressure, and delayed healing. If a patient is in severe pain, they may not even be able to participate in other important interventions like ambulation or education. Pain control comes.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX-RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
First, why are the other options incorrect? Option A, encouraging the client to express feelings about the surgery. While emotional support is important, this falls under psychological needs, which come later in Maslow's hierarchy. A patient in severe pain won't be able to focus on emotional expression until their discomfort is addressed. Option C, assisting the client with ambulation to prevent complications. Ambulation is crucial for preventing post-surgical complications like blood clots and pneumonia. But here's the thing, pain relief comes first. If a patient is in unmanaged pain, they may refuse or struggle with mobility, which could delay their recovery. Option D, providing information about dietary restrictions. Patient education is always important, but it is a lower priority compared to physiological needs. A patient in pain is unlikely to focus on learning until they are comfortable. That's why pain management comes before education in this case. What are the final takeaways for this question? Always address physiological needs first. Airway, breathing, circulation, and pain control take priority over everything else. Emotional support, mobility, and education are important, but they come after basic survival needs are met. If multiple answer choices seem correct, ask yourself, what will help the patient survive and stabilize right now? By applying Maslow's hierarchy of needs to prioritization questions, you'll be able to confidently determine the best course of action for your patients. Recognizing keywords and phrases. Every NCLEX-style question contains specific keywords that guide your thinking. Words like first action, priority, most important, immediate intervention, or at risk tell you that you must act quickly to prevent serious complications. The ability to identify these key terms helps you focus on what truly matters in the question. Now, let's apply this skill to an NCLEX-style prioritization question. Are you ready? Here we go. Imagine you're starting your shift and you receive a report on 4 clients. Your task is to determine which client you should see first based on urgency. Let's go ahead and drag and drop according to priority. Here are the 4 patients you will be prioritizing. The first patient is a client with diabetes mellitus who reports mild nausea. The second patient is a client with heart failure who has crackles in the lungs. The third patient is a client with a fractured leg who is requesting pain medication. The fourth patient is a client with hypertension whose blood pressure is 150/90. Take a moment. Think about which client requires the most immediate attention. Who should you assess first? Now let's break it down together. The client with heart failure who has crackles in the lungs is the highest priority. Crackles in the lungs indicate fluid overload, which can quickly lead to respiratory distress. This is a life-threatening emergency that requires immediate intervention. This is the first priority, without a doubt. The second priority is the client with a fractured leg who is requesting pain medication. Pain management is important, but it is not an emergency. This client is in discomfort, but can safely wait while we address the more critical respiratory issue first. The third priority is the client with hypertension, whose blood pressure is 150/90. While elevated, this blood pressure is not at a crisis level. The nurse should monitor and intervene as needed, but it's not as urgent as the respiratory issue. The last priority is the client with diabetes mellitus, who is experiencing mild nausea. While nausea in diabetics can be a warning sign, it's not immediately life-threatening. This client can wait while we address more urgent issues. Now let's go over the key takeaways for prioritization. 1. Always look for keywords in the question, such as first, priority, or immediate intervention. These words guide you to the correct answer. 2. Use the ABCs of airway, breathing, and circulation to determine which condition is life-threatening. And finally, remember that not all abnormal findings require immediate intervention. Some conditions can wait while emergencies are addressed. Great job! You're doing fantastic! Recognizing keywords and applying the ABCs of prioritization will guide you toward making the right decision in real-life situations and on your NCLEX-RN exam. Elimination technique. Use the process of elimination to rule out incorrect options and narrow down the correct answer. This is a super helpful strategy, especially when you're unsure about a question. Let's see how it works in action. Hash scenario. A nurse is preparing to administer medications to a client. Which action by the nurse demonstrates safe medication administration practices? Here are the options. Option A, leaving medication unattended. Option B, verifying identity. Option C, checking expiration. Option D, documenting early. Let's break it down step by step using the process of elimination. Option A, leaving medication unattended. This is unsafe. Pause and think about it. Medications should never be left unattended. Doing so increases the risk of the client taking the wrong dose or even forgetting to take it. This is a clear violation of safe practice, so we can confidently eliminate option A. It's not the right answer. Option B, verifying identity. This is the correct answer. Take a deep breath here. Before administering any medication, it is essential to verify the patient's identity using 2 identifiers, such as their name and birth date. This is one of the most important steps to prevent medication errors and ensure patient safety. This step is absolutely key in safe medication administration, so we can confidently choose option B. Option C, checking expiration. While checking the expiration date of the medication is important, this option isn't as directly related to the immediate safe administration practices as verifying the client's identity. It's still crucial for ensuring the medication is safe to administer, but it doesn't come before verifying the patient's identity. So, we don't choose option C as the first priority here. Option D, documenting early. This is incorrect. Medications should only be documented after they've been administered. Pause and think about this. Documenting prematurely can cause errors and lead to discrepancies in the patient's medical record, so we can easily eliminate option D as well. So, after using the process of elimination, the correct answer is option B, verifying identity. And there you have it. By eliminating the wrong options, we can focus on the right choice. This is a great technique to use in tricky situations. Keep practicing, and you'll get better at spotting the right answers in no time. You're on the path to success, and with each question, you're getting more skilled at critical thinking. Keep up the great work.